Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of December 11th, 2023. Today, in addition to the COVID status update, I will be talking about some recent outbreaks I've been getting questions about, from the 100-day cough to Mpox. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. COVID is still with us. It's still causing sickness, disability, and death, and there's still a lot we don't know. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. We'll start by taking a look nationwide, but remember that if you are interested specifically in what is going on in your area or an area that you might be traveling to, the best way to get a sense of what's going on is to take a look at wastewater in your area. I've linked about 5 or 6 different resources in the post. I suggest that you find one near you if this is of interest and kind of stick with that one. And a couple of the resources there provide information not only on SARS-CoV-2 concentration in wastewater, but also other things like flu, Mpox, human metapneumovirus, and so on. And right now, what we are seeing in most areas of the country are increases in SARS-CoV-2, influenza A in particular, and RSV. So I mentioned last week that the CDC has a new wastewater dashboard, so I wanted to share that briefly today, and the link for this is in the post. So you can see that wastewater COVID-19 national trend. So nationally, the wastewater viral activity for COVID-19 is currently high, and the region with the highest wastewater viral activity level is the Midwest. And you can click here to check out the different states and territories. But this is another way to visualize each territory. So we can see this orange line is definitely the steepest, going up the highest. So again, that is indicating the Midwest, then followed by the South. And those are both above the national average. We can also see that COVID-19 variants are indicated here on another page. And so we'll go over this more in detail in the future, but this is showing that the predominant variant now is EG.5. And as we can see in this most recent week here, the week ending December 2nd is where we first start to visualize the BA.2.86 variant in the wastewater. And we're just going to kind of be watching this to see how this correlates with finding the variants in the specimens, which is the one that we've been looking at up until now. But it's great to have another tool here where we're actually getting to see what the sequencing in the wastewater is, because this should, at least in theory, come sooner than trying to detect new variants via samples that are taken from patients. So this, again, wastewater being the earlier indicator that it is, I'm glad that we have another metric that we're looking at, which is sequencing. And we will come back to talk about variants more in a moment, but first taking a look at the COVID tracker. As you can see, all indicators are heading up. The early indicators, which are test positivity and emergency department visits diagnosed with COVID-19, those are both heading up. And the severity indicators of hospitalizations and death are also both heading considerably up. And most concerning, I think, right now is that hospitalizations are heading up significantly. The week ending December 2nd, they were 17.6% higher than they were the week before. And this might be an impact of the Thanksgiving holiday time, because that was about 2 weeks before this. So that's something we will certainly continue to watch. And so taking a closer look at hospitalizations, we can see that we were at 22,513 hospitalizations for the week ending December 2nd. That's a pretty significant increase that we're experiencing right now. And if you kind of look across to the left there, you can see that we've now surpassed our summertime surge already. So we're already higher than the peak that we had in that summertime wave. And we compare that with the year before, so last year, we can see that in the winter, last winter, we surpassed the summertime peak as well, but not until January. So we're here now in early December. We've already surpassed our summertime peak, and we'll just keep watching. Now, last year at this time, we were all kind of bracing ourselves for a December wave, but thankfully it never got as big as we were concerned about. It didn't really start to pick up until January, but of course, we were all bracing ourselves because the year before, the Omicron surge just caught us all pretty off guard and was kind of triple what we were expecting. So every year is kind of a new year. Of course, we hope that we'll continue the trend of getting less, but there's really no guarantee about that because we just are still dealing with, unfortunately, this evolving situation with a lot of transmission and with still a lot of evolving variants and mutations and new strains and so on. So every year is a new year, every season is a new season. Of course, we hope that things will peak and come back down soon, but unfortunately, SARS-CoV-2 does appear to be off to a pretty strong start here this winter. No signs of slowing down yet. And of course, because those other early indicators are already up, from wastewater to test positivity to emergency department visits, those are all of our early indicators. Those are heading up. So we know from all of our experience up until now that hospitalizations and deaths lag behind those. So those are the severity indicators that we can expect will continue going up as well. And looking at deaths, so this is the week ending November 11th. So this is already a month old. And we have at least 1,291 deaths for that week. And I say at least because every week they add more deaths to the week before as that documentation comes in. So each week we kind of see the prior couple of weeks being added to and going up. So with that said, we have been seeing around 1,200 deaths every single week, essentially for September, October, and November so far. And this is more than double where we were just this past June and July. And with hospitalizations going up, as I've said, we can expect this to keep going higher. And this is already quite a lot of people dying every single week. We know that many of these could have been prevented with timely outpatient treatment, also with people being fully vaccinated. So we just need to make sure that we're doing those things and accessing those things in addition to doing all that we can to reduce the spread of SARS-CoV-2. And looking at influenza, we are in flu season. We can see that flu cases are continuing to increase. For the week ending December 2nd, we were at 6.8% positive specimens. That's up from 6.2% the week before. Over 5,700 hospitalizations for that week. That was up from a little over 4,000 the week before. Now, 5,700 hospital admissions for flu, over 22,000 hospital admissions for SARS-CoV-2. And as I've said, we expect these to both actually continue to keep heading up. Unfortunately, we have had 1,600 deaths so far this flu season in the United States, and 12 of those were pediatric deaths. The graph there on the left, lower left, is showing continued increases in influenza A and B. And the map on the right is showing outpatient visits for respiratory illnesses, and we can see high and very high activity across much of the United States, particularly all along the South. And remember that at particularly high risk of bad outcomes for flu are those at the extremes of age, so 5 and under, 65 and up, also those who are pregnant. And the flu vaccine does significantly reduce the risk of a bad outcome. It's recommended for everyone 6 months of age and up. RSV nationwide continues to head up as well. Actually, by this time last year, we had already peaked and we're starting to come back down. So it was a little bit of an earlier RSV season than what we're seeing now. So just remains to be seen when and at what level we will peak and start to head back down. So this is something to keep an eye on, but really there is quite a lot of RSV out there. And so if you're 65 and up, or if you are pregnant, or if you've got a new baby where this is their first RSV season, or if they were born premature, please check in with your doctor about the RSV vaccine. Now taking a look at variant proportions, we can see here that the JN.1 variant is now showing up on the tracker. It's that purple color. I mentioned it last week that it was kind of being lumped in with the BA.2.86. Well, now it has gotten to enough sequences where it gets its own color here, and it gets called out on its own on the tracker, and it is now up to a whopping predicted 21.4% of specimens. So it is kind of coming on the scene pretty strong here. And we've got a little more information about the JN.1. It's got this special mutation. I talked about it when we first reported on this some months ago, but it has a special mutation on the spike protein and a few others that are in another area that are not on the spike protein. And this combination of mutations seems to help JN.1 be more contagious and also to kind of get around our prior immunity better than its predecessor. This team of scientists from Japan published this preprint here where they did some characterizing of the JN.1 in the lab, and they also did some modeling by looking at countries that have more of the JN.1 variant. And their findings seem to indicate that JN.1 could become dominant worldwide. So remember, these findings are in the lab and they're using modeling, and this can help provide indications of where we might be going. But it's really only with time that we will be able to see how it behaves specifically in people and in populations which have varying degrees of prior exposure to different variants. Even just looking across the United States, the variant proportions have been different. So how well you may be protected against one variant might just depend on which variants you had been exposed to before. So certainly the speculation is at this time that this could really help to drive a larger wave coming up here, and that is because of the two things I mentioned, that it is more transmissible, more contagious, and it evades prior immunity. So these facts are obviously not good facts. This is kind of not good news, but how much of an impact this has in the real world remains to be seen. So we will just continue to keep an eye on that. So this last couple of weeks, I've been getting a lot of questions that sound something along the lines of how worried should I be about this or that? And so I will kind of try to talk through how concerned or not should we be about these various outbreaks that are popping up. So first, I wanted to talk about whooping cough. I definitely heard about this cough that is just lingering. It won't go away. It's lasting for days and days. And what is it? So a cough can be any of these things that we've been talking about right now in terms of what is circulating. As I've mentioned, it's really SARS-CoV-2, influenza A and B, and RSV are the main things that we're seeing by the numbers. Of course, there are a number of other things that are circulating around, but we have been hearing about an outbreak that is worth mentioning, and it is about a cough that just will not go away, this terrible cough that just keeps going on, and it's even been called 100-day cough, and it has been in a number of headlines. So what is that? So what this is referring to is an outbreak of pertussis. So pertussis is also known as whooping cough or 100-day cough. People who have pertussis make kind of a whooping sound when they cough, so that's why it's called whooping cough. And the cough can last 3 months, and that is why it is known as a 100-day cough. Pertussis can be life-threatening, particularly for little ones 6 months and under. So that's really who we're worried about. Most adults do okay. They just have this terrible persistent cough. And the cough can be so severe that can even make you vomit. And with really severe cases, it can even cause rib soreness or even a rib fracture. But again, where it really is life-threatening is those little ones 6 months and under. And the way that those babies get protected is by pregnant moms getting the Tdap vaccine towards the end of their pregnancy. So that is super important. It appears that cases of pertussis are increasing around the world right now. And in particular, the UK is reporting a 250% increase in cases this year compared to last year. Pertussis is highly contagious. The good news here is that wearing a high quality filtration mask like an N95 or KN95 does offer protection. But really the best thing to do here is make sure you're up to date on your Tdap vaccine. And remember, with the little babies being at greatest risk, please keep this in mind. If you're going around a baby that is under 6 months of age, any immunity that they would have against pertussis would be from mom getting the vaccine while pregnant. So something to keep in mind. So I don't think that this is anything for us to get too excited about, but it is a great reminder that there are very contagious illnesses going around for which we do have good vaccines. So we just need to make sure that we stay up to date. And also a reminder that we're all very connected. So an outbreak in the UK shouldn't feel so far away anymore. I think we have learned enough to know that it really doesn't take much to import different things, especially contagious respiratory illnesses around the world. So it is an important reminder for us to stay protected. Next up is a health advisory from the CDC regarding an outbreak of Rocky Mountain spotted fever. So these Health Alert Network advisories go out to warn the public and also to advise healthcare providers about outbreaks that we should be aware of. So we've received notifications from our local public health departments in addition to this CDC notice. And this is to notify us of an outbreak of Rocky Mountain spotted fever among people in the US who had recent travel to or residency in Tecate, which is in Baja, Mexico. So Rocky Mountain spotted fever is severe. It progresses rapidly and it has an incredibly high fatality rate, maybe even over 40%. It is transmitted by a tick bite. So this is not human to human. You have to get bitten by a tick. But patients don't always recall having been bitten by a tick. The good news here is that the treatment of choice is doxycycline. That's a fairly common and easily accessible antibiotic. The bad news is what I already mentioned. Rocky Mountain spotted fever is rapidly progressive. And so that even means that there might not be time to wait for the lab results to come back to confirm that that's what it is. So the guidance right now is that anyone who has been in northern Mexico and within 2 weeks of being there develops symptoms like fever, headache, GI symptoms. There's a rash that goes along with it as well, although it doesn't always, swelling around the eyes, or certainly an altered mental state or respiratory issues should be seen emergently. Half of all people who died from Rocky Mountain spotted fever have done so within 8 days of the onset of illness. So very rapidly progressive. So really, we just want to be highly alert and have a high index of suspicion, we call it, if someone has been in that area in northern Mexico and within 2 weeks develop some of these symptoms. And the guidance there is just go ahead and start the doxycycline. Don't wait for results because it could be a matter of life or death. So far in this particular outbreak, there have been 5 patients with Rocky Mountain spotted fever in the United States who developed the illness within 2 weeks of their travel to northern Mexico. All 5 of the patients were hospitalized and 3 of them died. So how worried should we be? Well, if you traveled to northern Mexico, and certainly if you were bitten by a tick there, and if you develop symptoms within 2 weeks, then you should be worried and you should seek medical attention immediately. And if you know folks who've traveled in the region, it certainly doesn't hurt to just let folks know about this. But this is not something that can be transmitted from person to person. Like I said, this is where you would need to have gotten bitten by a tick. And right now, this outbreak is in northern Mexico. Of course, in areas of the United States, like here in California, where there is a lot of travel back and forth between northern Mexico and here, healthcare workers should certainly be on high alert for this. So just something to be aware of. And last but not least, I wanted to report on another CDC Health Action Network health advisory, which is to warn clinicians about a new outbreak of Mpox in the Democratic Republic of Congo. And I did have a couple of people reach out to say they didn't know Mpox was still a thing. Is this something we should still be concerning ourselves with? Well, Mpox is definitely still a thing, and we should still be making our best efforts to get people who are at risk of Mpox vaccinated with the 2-dose series of Jynneos vaccine. Mpox is still very painful and potentially disfiguring and potentially even life-threatening in those people with immune compromise, especially those with HIV/AIDS. But really, anyone who gets it, it's preventable, it's avoidable, and it's really painful and unnecessary. So anyone at risk should be getting both doses. We had a great campaign when the outbreak first hit, but unfortunately, a lot of people just got that first dose. So remember to get the second dose. But certainly the level of spread is much reduced from what we saw in the initial outbreak. We haven't seen any large outbreaks since then. We've just seen smaller ones here and there. But still, there is concern here in the United States because only 1 in 4 people who are eligible to receive the Jynneos vaccine for Mpox actually receive both doses. So once again, something we need to be paying attention to. But this particular outbreak that prompted the CDC to issue this health alert network health advisory on December 7th is important because this is involving clade 1 of Mpox, which is not the clade we were seeing previously. We were seeing what's called clade 2. And so we've not actually ever seen clade 1 in the United States yet. So should we be worried about this? I think at this time, it's again another reminder we're a global community. There's a lot of worldwide travel. We need to maintain awareness. We need to stay prepared. For right now, it does appear that the Jynneos vaccine or prior infection with Mpox should protect those who get exposed to this particular clade of Mpox. So the CDC is asking that healthcare providers continue to obtain specimens from lesions of people with suspected Mpox and that we submit them to check for both clade 1 and clade 2. And for the average person here in the United States without recent travel or contact with someone from that region, I don't think there's any need for particular concern. But I do think this serves as a reminder for those who are at risk of catching Mpox about the 2-dose Jynneos vaccine series. Particularly patients with HIV/AIDS should all be receiving the 2-dose Jynneos vaccine. It can be life-saving in that population. But here are the priority populations for the Mpox vaccine. Now, it's not limited only to this population because we have a much better supply than we did initially, but still it's worth knowing that these are the priority populations for the Mpox vaccine and everyone who falls into these categories, plus really anyone who feels that they are at risk should be able to get it as well. So the holidays are right around the corner, although there are these different outbreaks of things that maybe not everyone has really thought about or heard of before. I don't think that those are the main things that we should be worried about at all. We should be worried about the same old same, which is COVID, flu, and RSV, the respiratory illnesses, which are all increasing at this time. And with the holidays coming up, we expect it to go even higher because of all of the traveling and gathering that we know goes on around this time, plus the colder weather, bringing more people indoors to gather. And those, of course, can mean essentially super spreaders, outbreaks, and things like that if we don't take proper precautions. The precaution that I'm going to mention right now, because we have a little bit of lead time, is to mask up starting now. If you're going to be gathering, if you're going to be traveling, starting to wear a mask ahead of time, a couple weeks ahead of time, leading up to your holiday travels or your holiday plans or your holiday gatherings is a small sacrifice to be able to enjoy safer gatherings and to be able to get together in good health. So consider make an agreement with everybody in the party, everyone who's going to be at the party. to mask from now until you're gathering, and especially while on travel. So on public transportation, on buses, trains, and planes, in airports, in bus stations, even in the car with others. Don't let COVID come along the ride with you. Wear a mask, wear a good fitting mask, an N95, a KN95, and so on, and so that you can keep yourself and your loved ones safe. Because remember, just because you got COVID once and did fine, there is no guarantee about the next time. So please do what you can to avoid getting infected or reinfected and spreading it to others. Let's keep up those best practices to prevent the spread of respiratory illnesses. Gathering outside is almost always safer than inside. We know this can be hard with the cold weather, but if you're able to do it, get some outdoor heaters and do what you can to make it comfortable outside, at least so that there's an option for inside and outside. If you'll be gathering indoors, please make efforts to improve indoor air quality, like adding HEPA filtration units, keeping central air running with a MERV 13 or higher filter, opening doors and windows. And of course, if you need to be mixing with members of the public, especially if there was no testing going on, then wearing a high quality filtration mask is the best way to go. If you get exposed or if you have symptoms, conduct a rapid test every day or two while you continue to wear a filtration mask around others. If you or someone you spend time with unmasked would need to be treated if they got COVID, to prevent them from being one of those 22,000 people being hospitalized just in 1 week's time, or 1,200 people dying just in 1 week's time, then we need to be extra vigilant. We need to have a treatment plan. You need to have a testing plan. You have to get tested timely. So you may want to go ahead and get that more definitive PCR test if you can access it. All doctors should be swabbing and testing for this, along with other respiratory illnesses, or you can keep repeating those antigen tests. And remember, you can still get your free antigen test from the federal government, so don't forget to place that order. And remember that you generally only have 5 days to start treatment. The sooner, the better. Outpatient treatment reduces the risk of COVID hospitalization and death by about 80%. So well worth it, but your timing has got to be right. Please don't show up to school or work feeling sick and exposing others. Staying home and resting is best, not only for you, but for everyone you come in contact with. If you must go out, a well-fitted N95 mask could keep you from sickening or even killing another person. And remember to eat a balanced diet, incorporate fruits and vegetables, avoid those sugary drinks, consider a multivitamin supplement. And remember, if you don't have a primary care doctor, please get one. Get your blood pressure checked, your baseline labs checked, like your sugar, your blood count, your cholesterol, your vitamin D. Get some regular physical activity. Unless you're sick, please get your rest. Remember, we have seen correlations between not resting when you have COVID and getting long COVID. And it's always best to rest if you're not feeling well and not go around and spread what you've got to others. And lastly, try to manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We'll see you again next Tuesday at 10 a.m. See you then.